Hi everyone, in this video we'll talk about why it's important to manage your triglyceride levels, as well as various ways to do so. But first, you may be wondering, what are triglycerides? Triglycerides are a type of lipid that circulate in your blood. They are the most common type of lipid in your body, and they come from foods like butters and oils. In addition, extra calories that are not immediately needed are converted to triglycerides and stored in fat cells called adipocytes for future use. Are triglycerides and cholesterol the same thing? Many people tend to confuse triglycerides and cholesterol because they are often mentioned together in discussions about heart health, but they are not the same. While both are lipids, they are different kinds of lipids characterized by different structures. Triglycerides are fats, while cholesterol is a steroid. They also serve different functions, as triglycerides store unused calories as energy for future use, while cholesterol is necessary to build cell membranes and an array of hormones. Now, what do triglycerides have to do with the heart? High levels of triglycerides in one's blood increases the risk of coronary heart disease and stroke. This is because triglycerides are correlated with lipoproteins that contribute to the hardening and narrowing of your arteries, making it difficult for blood to flow undisturbed. High triglyceride levels are also a sign of other conditions that raise your risk of cardiovascular disease, such as obesity and metabolic syndrome, which is a condition when high blood pressure, obesity, and high blood sugar occur together.
There are several risk factors pertaining to high triglyceride levels, specifically a combination of genetic factors and lifestyle choices. Some health conditions that may increase the risk of high triglyceride levels are kidney disease, diabetes, and liver disease. In regards to lifestyle, infrequent or limited exercise, consumption of foods that are high in unhealthy fats and sugar, smoking, and an excessive consumption of alcohol can all yield an increased risk of hypertriglyceridemia. Genetic factors, while uncommon, are also present. Familial hypertriglyceridemia, for example, is a condition that occurs through genetic predisposition from parents. Further, gene environment studies have shown that those of South Asian ancestry also have an increased risk due to a high presence of processed carbohydrates like naan and white rice in the diet. There are a number of lifestyle changes that can have a positive impact on managing triglyceride levels. Many of these changes rely on dedication, consistency, and an external support system. Integrating heart-healthy foods in our diet, such as fruits and vegetables, whole grain substitutes like oatmeal and brown rice, as well as protein-heavy foods is a great start. Monitoring physical activity by working with a professional can help determine what level of physical activity is appropriate for you. This will help in creating SMART goals that establish a realistic time frame in which you can lose weight, build strength, and feel healthier overall. Engaging in mindfulness activities also allows us to alleviate stress and find fulfillment in our day-to-day lives. This is especially important for managing triglyceride levels. Fenofibrates have been the face of triglyceride medication for the last 30 years. They are used to reduce the amount of triglycerides in the blood and to increase the amount of HDL, a good fat that reduces the risk of heart disease. They are under the class of medications called anti-lipemic agents and work by enhancing our body's natural processes. Fenofibrates work through leveraging two of the body's natural processes. First, they induce the breakdown of triglyceride-rich lipoproteins by increasing the expression of a digestive enzyme known as lipoprotein lipase. They also increase the availability of these lipoproteins for entering the lipid breakdown pathway, known as lipolysis. Secondly, they leverage the uptake of fatty acids by the liver. This converts fatty acids to another molecule called acyl-CoA by enhancing the activity of a fatty acid transporter protein and an enzyme that produces acyl-CoA. In turn, this results in a decrease of fatty acid synthesis and a lower amount of available fatty acids for triglyceride production.
Some side effects from taking fibrates may be headache, dizziness, leg cramps, constipation, diarrhea, and/or stomach pain. You should see a doctor if you notice any muscle pain or weakness, jaundice, which is yellowing of the skin, stomach pain that isn't going away, or a skin rash. You should not take fibrates if you are a nursing mother or if you have liver, gallbladder, or kidney conditions, as fibrates may worsen them. If you are able to take fibrates, Be careful about taking them with blood thinners such as warfarin or with statins, as this can be unsafe if not discussed with your doctor. If you are on any other medications, herbs, or supplements, ensure your doctor is aware so that a safe treatment plan can be created. These are some of the fibrate medications that exist today with their generic name listed before their brand names in parentheses. Recent randomized clinical trials, however, have shown that although fenofibrates do lower the levels of triglycerides, they don't pose a difference in cardiovascular outcomes. As a result, future research is needed to investigate the true efficacy and benefit of this medication. Niacin, or nicotinic acid, is a medication that reduces triglycerides by making it difficult for your body to make them. It does this in several ways, but the main way is this. Normally, fatty acids are converted to triglycerides in your liver by an enzyme called DGAT2. Niacin works by inhibiting DGAT2 such that fewer triglycerides are being made and released into your blood. The side effects you may experience when taking niacin and their severity depend on how it is released in your body, which is determined by the type of formulation you are prescribed. For example, the main side effects seen for immediate release formulations is flushing. For sustained release formulations, flushing is reduced but replaced by moderate to severe hepatotoxicity or liver damage. Extended release formulations were created to reduce these side effects, but these have not been successful for everyone. It's also important to note that over-the-counter niacin formulations may be labeled as no flush to indicate that flushing does not occur, but these are generally ineffective for lowering triglyceride levels as they don't contain active nicotinic acid. Taking niacin with any of the listed medications and substances here may have negative outcomes on your health, so please consult your doctor for the safest course of action. These are some of the FDA-approved brand names for niacin. Among these, Niaspan is an extended-release formulation, while Niacor is an immediate-release formulation. Syncor and Advicor are combination drugs that have combined extended-release niacin with statins, which are drugs for managing cholesterol. For more information about statins, please see our other video about them. It is worth noting, however, that new studies show that adding niacin to statin therapy has little additional effect on preventing cardiovascular events when compared to just statin therapy alone, which, in combination with niacin's negative side effects, has led to decreased use of the drug.
Omega-3 fatty acids, more commonly known as fish or plant-based oils, are fats that play a vital role in the different physiological functions of the body. Naturally, our body is unable to produce the amount of omega-3 fatty acids needed to survive, and so our main intake is from the food that we consume. Unlike the unhealthy fats, omega-3 fatty acids are a type of polyunsaturated fats, known to be a healthy fat that supports overall heart health. The three main types of omega-3 fatty acids are eicosapentaenoic acid, or EPA, docosahexaenoic acid, DHA, and alpha-linolenic acid, ALA. The first two are found in fish oils, while the latter is found in plant-based oils. Our bodies digest these acids by regularly converting them from ALA to EPA and then eventually to DHA. Omega-3 fatty acids are a medication that reduce triglyceride levels while also raising HDL, or good cholesterol levels, and lowering blood pressure. This in turn lowers the risk for developing cardiovascular disease and blood clots. Generally speaking, this medication works by reducing the rate of hepatic lipogenesis, a chemical process that results in the production of a low-density lipoprotein, and thereby inhibits fat absorption and triglyceride metabolism. These are some of the common brand names for omega-3 fatty acid supplements and medications. All three typically contain around 900 milligrams of ethyl esters of omega-3 fatty acids, sourced from fish oils. These ethyl esters are the basic structural component of the polyunsaturated fats themselves. They also include roughly 400 to 500 milligrams and 100 to 300 milligrams of EPA and DHA, respectively.
Okay, let's wrap up what we discussed today. Triglycerides are a type of lipid or fat that flows in our bloodstream. They're vital for many different functions of the body, but at times they can pose harmful cardiovascular risks if they are not managed appropriately. Our day-to-day decisions greatly influence our triglyceride levels. Keeping up with exercise, eating a heart-healthy diet, and avoiding smoking and drinking are all key to maintaining healthy amounts of triglyceride in your blood. For those who need a little help from medications to achieve this, many studies have reviewed the effectiveness of 3 different medications: fibrates, niacin, and omega-3 fatty acids. Each play a unique role in reducing our triglyceride levels, but also come with important side effects to consider, which can be discussed with your doctor to find the right plan for you. Thanks so much for listening, and we hope to see you in another video.